So where are we?
This is the production facility.
At a warehouse in Baltimore, construction is moving fast.
This is quite a build out you guys are undertaking here.
Indeed, 44,000 square feet, and we are totally repurposing the entire building.
Ted Rebholz is president of Temescal Wellness. He gave 11 News an exclusive tour of their soon-to-be medical cannabis facility. For security reasons, we agreed not to share the exact location.
We will have the majority of the square footage for our plants, from clones all the way to the fully harvestable plants.
In a few months, the space will be transformed from this to this. Temescal also runs this production facility in New Hampshire, and they're anxious to expand to Baltimore.
So what's over on this side?
This side is going to be a mix of uses. After we harvest the plants, we need to dry and cure them, as well as trim them, and in many cases extract the medicinal cannabinoids from the plant.
Temescal Wellness is one of 15 companies granted pre-approval from the state of Maryland to grow marijuana, and one of 102 companies pre-approved to dispense it. They plan to hire up to 100 workers.
I worked at the Substance Abuse and Mental Health Services Administration for 16 years.
At the federal government?
At the federal government.
Temescal just hired Dicey Painter to make sure the company follows regulations. She's excited about the possible uses for medical marijuana.
If I'm leaving the federal government, this is what I'm doing, or I'm not doing anything.
Painter is part of a growing number of minorities and women entering the industry, now exceeding 50%, according to new data released by the Maryland Medical Cannabis Commission. The agency in charge of licensing recently came under fire for failing to grant minority-led companies licenses to cultivate. As state lawmakers consider issuing another round of licenses to minorities, another debate is brewing over the uses for medical cannabis, especially the potential use as an addiction treatment to help people struggling with heroin and prescription opioids. Temescal Wellness says they have patients in New Hampshire who have broken their opioid dependence thanks to cannabis.
The potential for providing to patients a non-toxic, plant-based alternative therapy, I think it's a no-brainer.
Some recent studies found decreased opioid use among medical marijuana patients. One study even found a 25% drop in opioid overdose deaths in states that legalize medical marijuana. Baltimore's health commissioner, Dr. Lena Wen, who's been nationally recognized for leading Baltimore's war against opioids, isn't sold.
We need a lot more evidence, a lot more research on how medical marijuana may or may not affect opioid and opioid usage.
Regardless, Wen supports medical cannabis.
There are patients who are in intractable pain, patients who don't have other options, or for whom their doctors say that medical cannabis is the best solution for them. So I'm glad that this particular tool is available to those who need it.
As the uses for cannabis are still being sorted out, Temescal is building on the possibility of growth. Adam May, WBAL, TV 11 News.